Tap send. Oh, I was my baby, you're from Calabos. The only boss. Wait, one is baby, I will be everywhere I day and everywhere they go. Tap send got me covered. It was therefore if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP send, and guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP send. Okay? But also, when I receive my money, the other tell the one with the channel, like my view, no, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send, it's secure, convenient, easy, and fast.
And it's just, I'm getting a feedback.
Yes.
Okay, as a technical team, can you check it? Genotype and some of the consequences that it can cause before you get married and before you get pregnant, sorry. So today I thought it would be wise to just talk about what's it called, pregnancy, the journey of pregnancy before, during, and then after, what is expected, what you should know, because pregnancy doesn't really end just during. I think we pay more attention to the during part of it, but we don't pay attention to what happens before and then afterwards. So today, I want everyone to understand that. And yes, kudos to John. I'm glad that I keep on having John appearing here. Before, when we started, it was Jonas, and I think I've missed Jonas so much. I don't know if you will ever join us again, but I think because of work, he hasn't been able to join us. But yeah, I do believe that pregnancy is a shared journey between a man and a woman. It's not just the woman alone. So from preparing your body as a woman, from preparing your body, and for the man too, getting mentally prepared, as well as the woman, caring mom, and then the baby after birth. I believe this session is really going to help you a lot. Not to sideline the men anymore, because I stand for both. And the men should pay attention, because I think women get to talk, they get to, our mothers or our health professional get to talk to the women a lot, but you should try as much as possible to, as a man, you should try as much as possible to be part of the journey. Why do I say that? In my experiences from the hospital that I was in before I left, most of the time when the woman comes, when the woman is pregnant and then she comes around, you don't normally see the man. And it's just that is Sogakope. It's a very small it's a small town, and it's on the Aflau Road. And I think the job that is quite most of these men do is motorcycling, Okada, and then driving these buses, Sprinter, and then this 207. So normally when they come to the hospital, you just see the women with their mothers, their sisters. You normally don't see the men. And when you ask them, they tell you that they are on the road. This is what they are doing. Sometimes it is understandable. Sometimes too, I feel that the men are also supposed to be there. Even not Soga Kofe alone, I believe it's something worldwide where normally the men are not present. But in this generation, I want to say the men are really doing well, and they are mostly present for that. They tend to support their wives emotionally. Now, what both partners should know is that before you even decide to get pregnant, maybe it could be that it's a decision you've planned, the unplanned ones. What you need to know that the moment you find out that you are pregnant, you should just go to the hospital and then start your ANC. If I say ANC, it's antenatal care. See your if it is planned, you see your doctor to or your GP to go through all these things with you, which I normally call the pre-conception care. You check for diabetes, you check for high blood pressure, you check for thyroid issues, because these are some of the common things that affect pregnant women. You'll be advised to take some supplement, especially folic acid. I don't give doses on this show so that nobody goes and then take a dose and say that one doctor said I should take this. But that is the reason why before preconception, you need to go and then see your doctor or your GP to take you through that. Why do we take folic acid to reduce what's it called? Birth defects. If I say birth defects, I mean that in Kofobi one. So, sorry, sometimes I forget myself that I have to blend the English with the tree. So say akranebe for me, BP na problem be the formation of the baby, and then not to have any disability or any defects criteria bedding, but defect, I mean defect. That the baby will come out and then there wouldn't be any problem, should I say, physically and then inward, inside. You need to be taking some of these supplements. Vaccinations, we need to check you if you have taken certain vaccinations. Most importantly, we are talking about rubella, varicella, we have hepatitis B, tetanus, HIV, and all these things. It is very important for us to check that you have these vaccinations. To maintain a healthy weight and a balanced diet is very, very important, because as a woman, you should know that you are now not alone. You are taking care of yourself and then the baby that is growing inside you. So, in all these things, the men also have roles to play. There are days where you have to walk in with your wife or your partner to the hospital to get them checked for these tests that I mentioned. you are supposed to also get involved in it and ask questions like, do you have these vaccinations? Because I always say that sometimes the women are the only people doing everything. But as a man, I remember I went for a program in Chatham, and then I was like, we should teach our boy child to ask questions like, what is endometriosis on your first date? And if you put the lady off, you should try and sideline the lady because, excuse my word, she's not serious. I mean, these are some of the things that, anyway, that was on a lighter note. You should try as much as possible to teach your boy child some of these things so that they can ask questions like this to those they want today, because it's very important. It is one thing to be all lovey-dovey and then another thing to fight health issues later on, because that can even break marriages or relationships. So yeah, what the men can do, as I was saying before, get checked too. Check your, I always say that before you say yes to anyone or you agree on a relationship, try as much as possible to run tests, especially checking for chronic illnesses and STIs is very, very important. Also, if you are a smoker, stop smoking, alcohol, drug use, because this can also affect sperm quality. And we don't often talk about this enough. There was a post that I saw somewhere, which is important for the men and the women as well, because each and every time when there is infertility issues, we go to our churches and then we are praying for, oh, we be abandoning our own and then all that, but nobody actually prays for the men for low sperm count, which is something that we should pay attention to, because we always think that it is the woman and all, but it's not that. Some of these bad habits can actually affect your sperm quality, which is important to in conception too. Support healthy habit together, your diet, your stress, exercise, gym together, walk together, do some running, jogging, and then all of that, because both of you need to be fit to be able to bring out a baby who is fit. Maybe so I know you say, I'm so much can be an amichika ewoni. So anyway, I want to believe that my parents were very fit. Or I don't know, maybe they used to do a lot of driving a lot. I don't know. But anyway, let's continue. Um, so during the pregnancy, what is happening? I'm going to break it into three, first trimester, second, and then third trimester, which is something I know. You go to the hospital and then they write in your book, they said first trimester, you probably don't know. That is from week 0 to 13, if I'm sure. I think it depends on where you find yourself, geographical area. In the first trimester, and what is happening is that the baby's organs are forming. There's going to be hormonal changes. You're going to experience stress, mood swings, nausea, and then get kind of bread and all of that. Men, you should expect these things, hormonal changes, just like when they are going through their periods. Trust you me, when they get pregnant, it's even worse. But there are some women too who don't even, it's not that bad. But other women, it is very, very bad. To me. Our mothers, we should take it easy on the younger ones who are coming, because back in those days, I think our mothers, you hear my mother will say, "Bia, oh, kekahona, sorry, na ye bibi say." I don't think it's it is the right thing to do, where you have to push them and enforce them, because during those times there was nobody there, to be honest. So they were pushed to do things on their own, and they feel that it is a sign of strength. But because of the environment that we find ourselves in, some of the things that we do now with the food that we eat and all of that, it may not be healthy for the baby, especially living in a country like the UK, US, or wherever it is, where before you even see someone, you have to probably go out, or you are going to pick a train or something. There's really nobody around and all of that. There's not enough support. It becomes very difficult, and then the only thing that you probably hear is "Kekahon you say" and then all that. That is not. It's good, but we shouldn't overdo it because it doesn't help. You try as much as possible to give them the needed support, because as at that time they don't feel it is hormonal changes, and then we know better. As a man, you should know that you go through this, and then don't say that me mami and kawaii say na mami and kawaii say. No, she's not your mother, And then that generation is different from the generation that we find ourselves inside here. Having said that, a man NDD a trim and also feel say you don't have to do anything because naturally I think some people have a lazy character, and when pregnancy also comes in, it is something else. I'm going to share a story. I had a patient who came or say she's having pains, and then she came to the hospital, and then yeah, BB, I realized that there is no pain. What is the problem? What's your BD watching? Or kind, and then you couldn't wait dreaming, and then you couldn't say on Tom. And I said, "You couldn't go yeah, Juma." So they came in, and the only thing that she really needed was the attention of the man and the food. This is a true life story, something we actually experienced at the hospital. And it was funny, but at the same time, it is what it is because as at that time they need attention. Hormonal changes, this is some of the things that you find out. So the key cares or some of the things that you should do is, like I said, the moment you fast 0 to 13 weeks, you find out you are pregnant, you start going to the hospital. It confirms pregnancy and then rules out what we call ectopic pregnancy. Maybe in future I'll talk about ectopic pregnancy, but it's also something that we need to pay attention to. You do some of the blood tests, even though you've done it before, we might want to do it again because if we don't have records of it, we have to do HIV, Hep B, your blood group, like we spoke about last week, and then iron, all these things, we need to check it. Your partner here has to support the patient and then help with daily tasks. For the second trimester, which is from 13, I said 0 to 13, so 14 to 27, what you need to do is that I call this the golden period, where there's less nausea, bone flow, baby. So there's more energy. You see the baby bump, it becomes visible. But it also has its own things. That's when your husband or your partner or then in Sabbath before we fool and then all that. As a case 5 born, I don't know if people know case 5 born, but anyway, that is how it comes. Here you realize that the baby bump becomes visible. Baby's movement starts around week 2019, 2021, thereabout. Then what is the key cares? This is the time that they will find any anomaly, any defect. So we do anomaly scan from 18 to 22 weeks. We check the baby's organs, if everything is fine. Your blood pressure and then your sugar monitoring is very important at this stage. We also check your mental health, which is something that we don't normally do in Ghana or in Africa, but your mental wellness is very, very, very important. The man, this is even a much more great time for you to attend clinical visit and see your baby scan. Like me, I say, "Nami trika no." This is the time that you probably see if your child was playing football. So that you won't say actually obey, but so na me trika no. Anyway, I was going to say also boy be a better than a footballer, but na me trika no me a doctor it doesn't. But you never know. You speak into it. Anyway, it builds the connection. You are happy to see how it is. Back in those days, they never used to have some of these things, but it is nice and it is very beautiful for you to see how a baby actually grows. Now we move on to the third trimester. This is around week 28 to 40. What is happening? The baby grows very fast. There you start having back aches, swelling, a lot of tiredness here and there because it's nuclear load or and the baby gets into the birth position, which is also very important. Sometimes if you are chronic to meet Danny, then it is or form, which it's something we need to look out. It's another topic on its own that I might probably speak about it in future. What is the key care that I normally talk to people about? You monitor for pre-eclampsia, signs of headache, your vision changes, and then swelling. Pre-eclampsia is also something we need to pay attention. These are all subtopics under pregnancy, so like we'll take it one by one as time goes. So pre-eclampsia signs, headache, vision changes, and then swelling. And this is the time that we need to plan your delivery. Are we doing cesarean section or are we doing a normal delivery? Your support person, which is your husband or whoever it is supposed to be there. Your bed plan. You go to your GP, you go to your obs and gynae specialist, and then you plan how you want to go about it. During labor and then delivery, this is what I call the game time. This is where agorɔ no ne nyinaa yɛ yi ɛsɔ. After agorɔ no wɔ fie no, mobile hospital, there is another agorɔ here. So what happens? You get to have regular contractions, water breaking, and then bloody show. These three things happen. These are the three things that you need to what's it called, pay attention to. So the contractions, I quite said it's like some, for lack of better words, I'll say some vibrations that you feel it is on and off. Every 5 to 10 minutes, it differs. So yeah, then water breaking, make water breaking a ocean Nigerian movie. See the baby is coming, baby saying you be now say by the no. Why the water? The baby a clownish sac, which is called the amniotic sac, and there is a fluid around it. Into a tippet realizes saying you know the water that is inside comes out. You see some blood here and there. So I forgot this. Yeah, I think I spoke about it. The birth options, we have the vaginal birth and we have the cesarean section. These are what's it called? It's based on what we are dealing with. If there is no complication, if the baby's position is normal, the mother's health, everything is okay, we'll just go for normal delivery. But then if there is any other things, then we'll just investigate and then we'll monitor and then we'll plan. Normally, pain relief, if it is important, we give. But I'm not going to speak about, because I know a lot of people go like, oh, I want a epidural, I want this, I want that, and it can count. But I'm not going to go into it. The partner's role in this case, you have to be calm and supportive. I said last week that sometimes it be me about labor ward and then no because what is actually going on and what the women go through, they go like, hey, and some people don't have the heart to stand for some of these things. So you have to be calm and supportive in these cases. The men are also to be mentally prepared. So I advise, if you are going, carry them along so that when they talk to them, they also listen. It's also advisable for any doctor or a GP to actually talk you through it, or a specialist. You have to help with timing contraction, because like I said, it's a shared journey. To quiet, make sure say time your contractions, and then it's also nice when the husband also helps with time contraction, because this is the time, like I said, likes to play around it. So whilst you are doing that and taking all the pictures in the wall to keep it and then make an album, you help also time contractions. You know your bed plan. You have to agree what works best for you, and this is where I go like, don't let external influences, whether your mother's experience for the man's side or the woman's side, what they went through is different. It is your world. It's okay to seek advice, but it is not what my mother has said. So at this point in time, it is what your doctor is advising you and the option that is on the table. So they will help pick your bed plan, and then you go ahead. Okay, now the baby is out. What do we do? Now, if the baby is out, what happens now is the baby gets the first vaccinations. I'm talking about BCG, OPV, and then Hep B. I think these three ones. When I remember, I think these ones are key. Then cord care. When I say cord care, akrano efumana and starting like that. Omucha, it takes time to heal, so you have to care for it. And yes, I'll be to an infection. So it's also something important. Sometimes we teach the mothers on how to do it, and they go home and then they have to care for it. Anytime they come for postnatal clinic, we have to check it, see everything is okay. This is the time where we watch out for what we call jaundice, fever, and then poor feeding. The baby is not able to suck. I've seen women with big nipples, and the babies actually struggle to suck on them. So they are not really having like good feeding. So it becomes a problem. It's something that we need to check. So what they are calling banners, you raise any complaints and we know how to go through it. Once I call any yellowish discoloration of the skin, like the skin, the eyes, or something of that sort, it should raise concern because that's not the normal color of the baby. So this is what we call jaundice. For the mother, look, bleeding. There's something we call lochia, which is bleeding. It is normal from after birth, from week 4 to 6. It is normal for you to see some spotting. But then watch signs for heavy bleeding. If it's very heavy, it's not normal. So you have to bring it. So you see some spot here and there. Watch out for signs of infection. What you are having headache and all these things. It says a stress after giving birth, but if it's not normal or anytime you see anything of that, any signs like that, just rush to the hospital. Breastfeeding support, like I said, you should make sure say your nipples are no sores or breaky or anything of that sort, because you are feeding the baby directly from your nipples, and infection can actually take place, which is something maybe people underestimate, but it's something that you need to pay attention to. Emotional changes, postpartum depression, it's something in our culture or in Africa we don't really say much, but postpartum depression is very real. And then sebe utimi hu maame bi I be our own baby, yes, so about them, and we just say it just like that. Probably the stress that the person has gone through and all these things, we don't pay attention to them. It's a broad topic on its own, which I'm going to talk about it, but it is real and it happens. And I always say that mothers need as much as care after delivering, because as during pregnancy, because we have this culture of it is only during pregnancy that we really pay attention to them. So this is the chance for the men to step up. So, like I said, it's a shared journey, and then you don't just get up and then just after that you just feel saying, no. Now, when all these things are done, family planning and long term, do you want to have another baby? If it's your first one, and I say you are actually done, don't wait too long to talk about family planning. What do you want to do? Like all these things, when you are planning, you have to discuss it with your obs and gynae specialist, and he will guide you how you are supposed to actually go through it. Because when you do CS, there's a period of time. If you want to do normal delivery, there's a period of time that you have to wait before you can actually do it. We need to assess you and all these things. If you are done contraceptions, we need to talk to you about it. Are you taking pills, injections, or you are going to do implants, IUDs, condoms, or we are going to tie your tubes? So discuss your spacing of pregnancy too, which is also important. Your follow-up up at 6 weeks post-delivery for a health check is very, very important, and people get done with that. So I think basically that is it. So my final words to bring the presentation to a close, I'm going to say pregnancy is a partnership. You support, understanding, and shared responsibilities is very important. A&T or antenatal care save lives. Don't skip appointments. Never skip appointments. Mental health is important as physical health. You need to pay attention to that. Knowledge is also power. The more you understand the journey, the better decisions you make. Thank you very much.
As ever, thank you, Dr. Kodzo, for your for taking us through the pregnancy steps and how our male partners can support us. So we'll, as per usual, we'll be back after a short commercial break, and then we'll take on any questions. Bear in mind, you can ask specific questions pertaining to today's program, today's topic, which is pregnancy, or you can ask any and every general health question. So see you shortly after the break.
Me did young antechua, and maybe I'm discovered for you, Pakuma Busia for Ghana. No, me use tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Won't you? Me discover ye map him. Tap Send. Inti enne, also download the TAPTAP Send app no ewo mobile phone so free. Na fesika komo abusuafo wo Ghana afa na nyina. TAPTAP Send. Papa no.
So physical money and put me do rap to so me send ya my within a minute in Sabakandia and then one tap send.
Yeah, ebusuafo amanfo me din di na akoma pachrewa 1 they recommended tap send amamo and that's for aba o send ko fa baby a na ye basa omo rate so ye omo ye A1 nti obian load tap send na on say sika for tap piao
yɛbɔ hu de wo kyerɛ amansan yɛbɔ hu de wo kyerɛ Ghana for say yɛwɔ akwantu ne di sika kofi nie me yɛn fɛmfa baabi a yɛbɛnu yɛn ho tap sign tap edemu fua tap send in this asu
Tap and one na
tap de no na
Hello, and welcome back to the Health Talk Show, where today Dr. Kodzo just took us through the stages of pregnancy. And so, without further ado, we're going to open the floor up to now Q&As, questions and answers. So if you've got any questions, bear in mind they can be health any health related question or specific to this one. Since there are no hands up, Dr. Kodzo, I will start. Oh, there is one question that just came through. I was just going to ask at what stage would you say is best to start taking folic acid? At what age or stage is it best to start taking folic acids? And then we'll go into this question.
It's part of the pre-conception care, and depending on first of all, we need to find out if you're on any medication and all of that. So I can't put a specific time to it if I don't know anyone's conditions and all that. Rest assured, there is something that I always try as much as possible to also avoid, that telling people what to do, unless you just walk in and then just go in and see your doctor for them to actually assess you. But it's normally before you even think of having preconception.
Okay. So that would be any time, 2 days before I think of having.
Oh, no. Oh,
okay, that's fine. I'll take the question inside the chat and then we'll go to you, Bridget. So for now, let's start with Kobe's question, which is it safe to have sex during pregnancy? If yes, what time?
Before you continue, are you looking for a specific timeline before you do it, or I don't know?
In terms of the follicle?
Yeah.
Yeah, in terms of at what time would you say is best? Is it, do you have to even wait to be conceiving, or do you take it when you're kind of off, I don't know, what's the name that they give to women, when you are able to, when you're fertile enough to give birth, or something like that?
Yeah, I remember my boss telling me that even folic itself is recommended for all women of childbearing age.
That's what I wanted to hear. That's the phrase.
So, but for time's sake, let's say time period or whatever, 1 month to 3 months. But then it is something we advise women to take childbearing age.
Okay.
To take folic acid, yeah.
Okay, fab. Childbearing age, yes, it's the moment you start menstruating, isn't it?
So it's yeah.
Okay, no, I hear you. I understand. Thank you.
Yeah.
So Kobe says, is it safe to have sex during pregnancy? If yes, what time and positions are best? I like this question.
The person already knows.
I like this question.
Yes, it is safe for Yes, most women with a normal and then healthy pregnancy, it is advisable for you to have sex. Sex during pregnancy is it doesn't harm the baby. The baby is protected in the amniotic sac, and there's I believe that there's enough protection for the baby. So yeah, we normally advise you to. Anyway, we normally advise what is that position. Anyway, they call it doggy. So we feel that. Why are you laughing, Abna? That's what I.
The way you said they call it doggy, is there any other name for it?
That's what they say.
No, is there any other okay? Is there any other name for it? The way you said it's like they call it doggy, like
My,
is there a professional name for it?
when I went to, they didn't teach me about that one. But yeah, you. I think a lot of people know. I don't have to go into detail. So yes, I think that's.
Doctor, we're on the health talk show, so if detail is required, oh anyway, Kobe, if you need require details, please let the doctor
I
know
think you should. Yeah.
so that he can give you the details that you
Yeah.
require. Thank you. Bridget, please.
Oh yeah. Sorry. Aside that, we advise the woman lying sideline when the woman lies side by side, and then also the woman on top. This is very weird, but the woman on top, it's also advisable, especially in your third trimester. Yes.
Okay.
Yep.
Interesting. Bridget, please. We'll take your question.
Hello, good evening, please.
Hi, good
Um,
evening.
my question is, I just want to know, can your placenta move? Because I've been having regular scans because they were worried. They said my placenta have dropped down, so it got me scared. And I just want to know that can it move while you're pregnant? And is it because I'm lifting something heavy, or like what's causing that? Just if you can please help me, just to give me idea, just to know what's happening.
All
Thank
right.
you.
Yeah, great. Yes, the placenta it can move. It doesn't, the position of the placenta, what does Princess say? All right, sorry, I'll read that later. Yes, the position of the placenta can actually change. So how it works. So in early pregnancy, especially around 12 to 20 weeks, what happens that the placenta may appear low-lying, sometimes even covering the cervix. As the uterus expands upward, the placenta often moves up with it, especially, let's say, if it was actually near the lower segment. A low-lying placenta in early pregnancy, it's common. In about 90% of cases, it moves upwards by the third trimester, and it doesn't cause problem. But we have conditions we call placenta previa, and this is where the placenta is completely covering the cervix. It is not good because the baby need access to actually drop down, and this normally happens after 20 weeks plus. So your the scan, I said from 18 to 22 weeks, when we start doing these anomaly scan, we get with even after that, we get to see some of these things that are actually happening. So I don't know how many weeks you are. I don't want you to declare it here, but you can probably just text me, message me privately. But if you go and they say that it has moved, it depends on the stage that you are. And then is there a cause of alarm? They should be able to explain it to you. So yes, it can actually move.
Dr. Kojo, don't worry, I'll read the question to you.
Let me just close it. I don't, sorry.
Oh wait, are you done with
Yeah, I'm done. Yeah, it can move.
okay,
So
thank
that's
you,
it.
Bridget.
Yeah.
Thank you. So Princess just said that truth is any position the mother feels safe and comfortable in, which I agree with. If you feel safe and comfortable with both of you.
Anyway, Princess is my sister, and every time she does herself a backup, I don't know. Any position that you are comfortable, okay, go ahead. If you go and do some position and then something happens,
Clearly, the pregnant woman will not be comfortable in some positions.
okay.
Hence,
Then
maybe
if,
comfortable
I
if they
think here
can.
too, the men are also supposed to be firm on certain things because
Yeah.
if it's going to harm the pregnant woman and then the baby or something can actually happen. You can't tell me that you are pregnant and you want to climb the kitchen counter. It is not possible. It is not. Yeah.
Okay, true. So yeah, this is where the men's leadership and authority can come in. Okay, fantastic. Follow-on question from Kobe, who says in Europe, particularly Italy, pregnant women barely take supplements of vitamin. Why is it that here in the UK they recommend folic acid for almost every pregnant woman?
Every pregnant, they recommend folic
Folic
acid.
acid for almost every pregnant
Okay, I
woman.
don't know if he was here before I started, but then I mentioned that folic acid is needed to prevent birth defects. And another me penetrate in another me, you know. So yes, they are trying as much as possible to prevent birth defects. So whether you like it or not, you have to take it. Back in those days, I don't know how they used to do it because there was no folic acid. But then I want to believe that culturally, dietary factors, the food that they used to eat back then, especially fresh fruits, green leafy vegetables, and all these things had it contained some of these things. So because we don't want to, we are preventing birth defects. Just have it in mind. Because maybe I'm a cannabis be now you sure why not you take it serious. One person clan but not the conwachi say. Let me just put it like that. And it me my mouth for you. I mean, in practice, this is something that we do. You have to say something so that it scares them so they will do it. Because some people don't do it. Anyway, yeah.
I was exactly that, Princess. I was actually going to ask Kobe. I think it's to do with, I think, said the kind of European side that are close to the Mediterranean, so that's Spain for only the Italians, they probably have more organic foods or they eat more organically than maybe we the Brits do, which is the reason why they don't stress on the supplement aspect so much so because maybe they encourage more organic kind of lifestyle over there. So yeah. Bakobi, you can always confirm that for us. Okay, and then a question from John. What's your take on eating of superstitious? What's your take on the eating of superstitious beliefs of not eating eggs, okra, snails, granite, and drinking malt Milo during pregnancy?
um, this is where superstitions are superstitions. We it's something that we believe. I want back in those days. What happened back in those days is that someone might take something and it doesn't work for the person, or something might happen and then they might probably blame it on what they probably took, which is the reason why we need to sit you down and take you through, excuse me, the journey of pregnancy itself. Honestly, many women are told to avoid certain foods in pregnancy because of what they have heard and not what is medically true. Eggs, because the baby, you can hear something like because the baby grow too big or smelly. This is something that you hear back, say, yeah, BBC. You know, okro, you hear something like it makes the delivery slippery and causes too much what's it called, discharge or something of that. So all these things, truth to be told, um, I don't know who came out with that theory or wherever it's from, but if I'm supposed to take everything one by one, eggs are good if it's cooked, if it's safe and is beneficial, if cooked well. So if it is cooked well, it is safe and it's beneficial to the woman and then the baby. When it comes to okra, it's very healthy. It supports digestion and prevents constipation, which is something that you need. When it comes to snail, it is also safe when it's well cooked. You avoid the raw ones or when it's from a questionable source. It's something that if you don't know where it's coming from, that is the reason why even when you are pregnant, it's safe for you to actually cook. When it comes to granite, the only thing I know is that it is safe unless the mother is allergic, right? When it comes to Milo and malt and these drinks, occasionally, but this is where you need to limit your sugar content, your sugary drinks, because Milo contains sugar, and you focus on, at this point in time, you focus on more water and natural smoothies. I believe in natural smoothies a lot. So you're just, for the malt and the Milo aspect of it, it's just because of the sugar. And I mentioned that there is a time where you need to, what's it called? When you start your first trimester or before you do a lot of tests, they have to check your BP and then your glucose and then all of that. So yes, I don't believe in all these things, but yep.
Sorry, I was muted. So, a few questions in there. Another question from not another question from Bright. Medically, can you explain how a woman should prepare for conception of a baby? For example, a lady who hasn't given birth before, and how is she ready to conceive, or how she should prepare herself to be ready to conceive, kind of thing.
All right. So if let's say the lady or the woman is, what's it called? Ready is like something that is planned. Like I said, you plan. So we have something we call a preconception checkup. You schedule a visit to your GP, your gynecologist, and you discuss your menstrual history, your past illness or surgeries you had, your family history of genetic conditions, your current medications that you are on. This is the point where your doctor will, or your GP or your gynecologist will encourage you to start taking folic acid to prevent these defects. If you have diabetes or if you're epileptic, if you've had a previous baby with defects before, these are all things that you will be asked. One thing, aside the hospital visit, one thing that you need to do is to have a healthy weight. You don't want underweight and an obesity because it can cause fertility issues or pregnancy complications. This is where you eat a balanced diet. You focus on more fruits and vegetables, you eat lean proteins, iron-rich foods, all these things are needed. This is where you limit your junk food. Your Milo and your sugar comes here in play, where you need to limit your sugar and then your caffeine, alcohol, smoking, you stop all these things. You need to track your ovulation. Let's say you are trying and you don't know. This way you need to track your ovulation and menstrual cycle because there's a target where you need to hit during that menstrual period for you to be able to achieve the goal. Also, at the hospital, we might probably update. We might take you through your vaccination update. I don't know if I'm using the right words, but we need to check whether you've had your rubella, like I mentioned, rubella, Hep B, tetanus, varicella, chickenpox, all these things to know that maybe you are okay. Your mental health is very important. Are you mentally ready? Because a lot of people are scared of it. If you're not mentally ready, it's something that we need to take you through, probably assign you to a mental health doctor, and then take you through the journey. So these are a few things that I can mention. Aside that, if you see me in my office, I'll go on and on and on and tell you more. So for now, I mean, these are household things. And also include your partner. It's very important for you to, your partner should be healthy, like I said. At church, we are always praying for women who are not able to conceive, but no pastor is praying for men with low sperm count. You see, it's very important. Yes, include it.
We will tell the pastors to include them.
Yeah, because healthy sperm is healthy pregnancy. Yes.
Yeah, absolutely. Dr. Koz, I think a while back, maybe he's probably in lunch, I'm not sure. She did a piece on healthy sperms, isn't it? I remember she put a whole weight to it. Yeah, great. We've got a few questions coming in anonymously, and like on my phone, and I've got a few questions in the chat, so let's go through them. Next one is Benedict. Is there any way to have twins scientifically, since I have many twins on both parent sides?
Having twins on both parents' side.
No, he's asking for himself. So is there any way to have twins scientifically? That's the question. And then they just added he has twins, many twins. He has many twins on both parents' sides.
There's no guaranteed way from what I know, unless a senior colleague or something, someone who has more experience than me, but there's no guaranteed way. But certain factors due to like genetics and some fertility methods, they say can increase the chance of having twins. And probably if it's in your family, like I mentioned, genetics. So if it's in your family, someone in your family probably have twins. I believe so. And I heard that using these fertility treatments, ovulating, stimulating drugs that they use can also. And I think, yeah, I think in vitro fertilization, but these things are used under strict medical supervision. So it could be, but I'm not in that field. So fertility per se, but I'm really not too um what was the word that I use? Is it abreast or whatever? I don't know. I don't know much of it like that. But yeah, this is the few that I know. Yeah.
Thank you, Doc. Thank you. And next question. Apparently, eating lots of groundnuts during pregnancy would help the baby not to have a nut allergy. Is that true? And if it is true, does it run true for other types of foods as well? So, like, if you eat any type of food a lot during pregnancy, then the baby wouldn't have the allergy to it.
As a researcher, I like to, if you if you say something, I need to know where you are getting it from. But then I've also, my boss has said something that evidence says it may help. I don't know because I think there's a study called the LEAP study, LEAP. LEAP study have shown that I think early exposure to peanut in the womb through the mother's diet can help the baby's immune system become tolerant rather than allergic. So yes, I've heard about this. I haven't done like a lot of reading on it, but yep, this is what I can say. So apparently the person might be right.
Very interesting. I've got quite a lot of questions coming in here, and they're grouped into like themes. But let me try and go through I think we've got two more to go through in the chat, and then I'll come up to the ones coming on through my phone. So we've got Benedict says, my wife missed period for 2 months. She did different pregnancy tests in that period of time, and it was always negative. Even when I did the test with the GP, she had spotting on the last week of the second month and had period the week after. What could be the reason for the missed period?
It could be a lot of things. Possible reasons. It could be hormonal imbalance, like polycystic ovarian syndrome. I don't know if I've spoken about it. It could be due to stress. It could be well, it could be maybe your dietings, post-infection diet, something that you are probably, I don't know, but I'm not too sure about that. But I think your, let's say, a viral infection or you are recovering from something and chronic illness. I mean, it could be early miscarriage, chemical pregnancy. So it could be a lot of things. So those are a few that I can touch on.
Okay, thank you. And the last one in the chat before I go to my phone, which is, how can strep B be prevented in pregnant women?
Strep B be prevented in pregnant women.
Yeah.
First of all, I don't know, streptococcus infection. Okay. So you need to, how do I even say this? An infection is an infection, right? So you just try as much as possible to stay, because I wanted to start talking about how you get strep B and then all of that, but time is not going to permit us to talk about all these things. But then you need to know what this whole strep B is. But I can only say screening And also you have to take what is the word for it? I think intrapartum antibiotics prophylaxis, which we call the IAP. And yeah, I think these are the two that I can actually mention. Screening is part, like if you go to the hospital, like routinely screen for what's it called? Between 30, I think 34, 35 to 37 weeks of gestation. If we screen and then we realize that there's something there or whatever, we can start treating it. But aside that, intrapartum antibiotic prophylaxis is very important. So we normally give penicillin or ampicillin intravenously just to prevent some of these things. So, and also good hygiene, I think is important. Yep.
Okay, thank you. Now I've got questions here grouped into a theme. So, for example, I've got questions on travel and I've got about 3 or 4 in there. How do you want to take it? I say everything and then you give
Travel.
travel related to travel. So questions related to pregnancy and travel.
Let's take it one by one.
One by one. Okay, this one is just general. This doesn't actually fall in the other ones. There are quite a few questions coming up. What pain relief options are available during labor?
Once again, if you know me, I don't talk about medications here.
During labor, though, during labor, that would be okay. Well, actually,
You have, you see, the reason why I don't talk about medications here is because some people go to the hospital, probably you start taking something, or you go to the hospital during labor, and then they are doing what is best for you, and then you have heard that, let's say, epidural is good. So you go ahead and then you are insisting on epidural, you conflict to what they are doing, the professionals are doing. So if you go, it's part of the bed plan. So they will discuss it with you, what you really want to do. I don't talk about medications. Thank you. To be on the safer side.
Okay, thank you, doctor. So all these questions now fall under travel. Let's take it one at a time. Is it safe to travel during pregnancy?
Oh, yes.
What are the risks of flying during pregnancy?
Very important. It depends on your gestation week. So at a certain week, we don't advise pregnant women to take to fly. Just because it can actually lead to complications of the pregnancy, and then it could be, let's say, should I say mid-air or something where there's nothing can actually be done about it because the way the train moves, like the should I say the speed or whatever that's gravitate toward, not the gravity per se. I'm not well. It has something to do with that. But then again, how the train fly, the speed that the train is. Did I say train? The flight.
This whole time I was going to say the
Sorry.
train flights.
I do a lot of training.
It's okay.
Yeah. Anyway, so the speed at which the flight is taken, and then mid-air too, anything can happen because some babies can be very stubborn, and then if it happens mid-air, it's a whole complication on its own. But then at a certain gestation week, there are certain things you are not expected to do. Limited movement, you understand? Because this is where if you don't take care, you might probably start having miscarriage, or it's not even miscarriage. I mean, it can happen. It depends. If you have turbulence in the air and all of that, it can cause complications to the baby and then the mother itself. If you are probably even bleeding mid-air and then there's no first aid to be given. I mean, they can do what they can do, but it might also affect the travel where they have to even make safe landing and then all of that. So we don't advise you to get mid-air, travel on flight when you are at a certain age. It's not advisable to do that due to some of these complications.
Sorry, muted. Thank you. Next question is, what is the best time to travel during pregnancy?
From your 0 to 0 to probably 28. I don't know if it's too much, but I think 28 there, 28, 29, 30. Because I mean, some people can come or some people can start their labor as early as I think from 32, 3, 4, 5. I'll probably stick to 34, 35 thereabout. So it's not advisable. But I think every airline also have their own. But as a general rule, I think from 34, 35 onwards going, I don't think it's advisable for you to. It depends on your pregnancy too. If let's say you have a complication or something of that sort, or it's a high risk, we call something high risk and low risk pregnancy. Maybe as another time when I start picking all these sub things under pregnancy, I'll be talking about it. So if you're a high risk pregnancy, they are from even as early as 30, if you're high risk, there are certain things we don't even allow you to even do. Because imagine a pregnant woman who is already hypertensive and you are even scared of flying and you panic a lot or something of that sort. We don't even advise you to even hit on that plane in the first place. So yeah.
Okay, thank you. So, what precautions should I take during travel?
Whoever, I don't know what kind of travel, if it's the same plane, I don't know if you go and tell the pilot that the pilot should slow down, but if you are driving, obviously, the driver or your partner, that is where it's also advisable that your partner gets involved. You try as much as possible to not speed, be hitting ramps, what's it called? Um, potholes. And also you, the mother, if you're on any medication, you make sure that you've prepped yourself for the journey and then you take your medications. You have to eat when it's time and then all of that. So these are some of the safety precautions that you need to take. Because I remember back in Sogakope, the mode of transportation is motorcycle, most of them. So you can imagine if they are coming to the hospital or they are even at labor, that's how dangerous it is. Like they come to the hospital on motorcycles, which is not advisable. So, yeah.
Yes, I was going to say there's another question about taking what precautions should I take for long car journeys? So I was going to say I should have combined the two there.
Also, you don't need to sit for long. Okay, I just remembered. On the flight, right? We are also scared, or we are because of this sitting for long hours. It's also something we need to pay attention to. You really don't need to like sit for that long period of hours. It's also not healthy for the mother and the baby. And also traveling, even normal travel, when you are in the car for a very long time, you realize that there are breaks in between where you need to stretch your legs and then all that. So how much more a pregnant woman? Yeah.
Yeah. So long car journeys, would you say like taking off breaks often, getting out, stretching your legs?
Yep.
Okay. This kind of ties into how can I make travel safer and more comfortable, isn't it?
Yeah.
Yeah. So yeah, just
if you know what is wrong with you, if you're on any medication, make sure you've carried everything that you need. You take your medication on time, take your breaks. Whoever is driving is supposed to, but you see, when you are pregnant, it's quite difficult if you are taking a public transport because you don't tell what the driver should do because you are probably the only person pregnant in the car. So we don't give what's it called? You don't give the driver instructions and all that. So it's much more safer if you are driving with your partner who knows your condition. So yeah.
great. And just to reiterate, the last question is when should I avoid air travel, which Dr. Kojo already mentioned. Most airlines normally do say it in their sort of like terms and conditions or whatever. But I think you said from 34, 35 weeks upward, should avoid all kind of travel if possible. Okay. few questions in the chat, then I'll go back to the questions in my there were lots of it always starts slow, but then getting to the end, like the questions really do build up. So let's try and go through them. So I've got questions here. What causes stillbirth? From two questions from Priscilla. What causes stillbirth?
Stillbirth. First of all, if you say stillbirth, not everyone who understands stillbirth, but stillbirth is the death of a baby in the womb after 20 weeks of pregnancy. It can have many causes. So anything that can cause a baby to die after 20 weeks. So you can have placenta problems, just like we mentioned. We have the placenta abruptio, placenta previa. Infections can also cause that. Birth defects can cause that. You can have umbilical problems. You can have mental health conditions, which we normally don't pay attention to, can also cause that. Lifestyle and risk factors, trauma or injury also. So yeah.
Okay, thank you. And the next question was risk of DVT, which I just had to Google. So deep vein thrombosis, risk of deep vein thrombosis. What are the risks? And she wrote perhaps wearing compression socks.
And what's the second one?
No, perhaps wearing compression socks. I would like to think that one is more so to kind of help it, but yes, doctor.
Okay, so DVT is when a blood clots form in the vein, in the deep vein, usually in the leg, and which if it is left like that, if it is not treated, it can travel into the lungs and cause what we call PE, pulmonary embolism. So when it comes to that, is relating to pregnancy, right? So blood is more in pregnancy and even postpartum. Blood is more prone to clot during pregnancy and then after childbirth. And also, it is very high 6 weeks postpartum. And what's it called? Also, did you ask causes or risk?
Risk of DVT.
Immobility. So this is where the plane also comes there, flying and then all of that. So immobility, and also if you want to know the reason why you travel a lot, even if you are not pregnant, and then you sit for a very long time at the office, and then they want you to just stand up and then walk around. It is not only about your posture, but we are also scared of DVT. So as a pregnant woman, prolonged sitting or bed rest. Let's say you've also had what's it called, surgery or trauma, it can lead to DVT. But for pregnancy per se, I would say immobility, sitting for a very long time, can lead to DVT. And then when it happens, it will cause pulmonary embolism and it can kill you like sharp. It can just, you deaf.
Wait, though. Why? Is it because it causes like a heart attack or something?
We'll talk about pulmonary embolism later on and what happens. It's a big topic on its own.
Okay, thank you. Next question. If a lady has regular periods, but then she missed her period for a long period of time, and then she has it back, what could be the reason? Married, no medication used at all, trying to have a baby. Also, pregnancy tests show negative in that period of time.
This is it could be a lot of factors. First of all, possibility, it could actually be that the person was pregnant, which causes the period to stop. I don't know what kind of pregnancy test that you did, whether it went to the hospital or the person went to the hospital. Sorry, I got a message and I got distracted. The person went to the hospital and it was confirmed. But then after childbirth or pregnancy, if the person is able to like elaborate like the period of time, because if you say missed it for a very long time, I may not be able to like give a depth, but I'll just give general things for you to know. After childbirth or pregnancy loss, or let's say even miscarriage, the periods could return after several weeks or month. Also, even if let's say she wasn't aware that she was actually pregnant, it could explain the delay or yeah. But then in this case where in this case where she was, let's say she wasn't pregnant, stress can also lead to that and lifestyle. It's our boss that I don't know if you can hear it. It's not that Kwame anyway. Tomorrow I have to be on TAPTAP.
Okay.
Oh yeah. Stress and lifestyle changes. I think I've talked about hormonal changes, which can also lead to you missing out because periods. These hormones helps with periods. So if let's say stress and lifestyle changes, you have high emotional stress due to let's say your work, you are in a relationship, major life event, someone died, can disrupt your hormonal imbalance and can also delay ovulation. So you might probably not be having. So it's different factors: stress, hormonal imbalance, pregnancy. It depends on the time that we are also talking about. If the person is of childbearing or the person has never had, if it's a younger one, we'll be talking about perimenopause. No, yeah, we are talking about if the person is in late 30s or 40s, the person can be entering menopause and what we call the perimenopause. So the transition before menopause, during which the life cycle can actually become regular, is something that some women also explain. So, yeah.
Thank you. And next question. Does ulcer have an adverse effect on your first pregnancy?
What?
Ulcer. Does ulcer have an adverse effect on your first pregnancy?
Okay, generally not a major issue if it is controlled. So from what I know, women with let's say ulcers can have healthy pregnancy. There are women who have ulcers and then they have pregnancy. And pregnancy itself can also lead to production of protective hormones like progesterone. And this may help reduce ulcer symptoms for some women, not all women, for some women. So in this case, some of the risks that you probably be having if let's say the ulcer is not treated or is severe, it can actually affect your appetite, leading to, let's say, poor nutrition where the baby the baby might not feed well, which is also important in development of the baby or the fetus. Also, a bleeding ulcer, if the ulcer bleeds, it can lead to anemia. That is what we are also scared of. And also, let's say another concern that we'll probably look at will be, let's say, medications. Some, what's it called? NSAIDs are not safe during pregnancy. And also, medications like omeprazole omeprazole and ranitidine, they are considered safe, but then they shouldn't be used. They should only be used under medical supervision because we have to monitor you because it can also have some side effects. And also, what else? A general thing I know about ulcer is that psychological stress can also what's the word? Aggravate ulcer and impact on the pregnancy outcome. So it can lead to risks of preterm labor. Yes, it's something that it can lead to preterm labor. So yeah.
Thank you. Now on to the questions. Got a question here about diet. So what food should be avoided during pregnancy?
I like that. I'm going to bring my senior, Chris, to talk about the food that you should avoid during pregnancy because I'm not a dietitian. Sorry, I'm not a dietitian and I can have general knowledge about it, but Chris will be able to go into details and then tell you what you need to eat. But they're both healthy.
So I'm sensing that is a Another topic in the making.
Yeah, pregnancy is broad. So if I'm going to take it like one by one, we're going to take high risk, low risk, and all of that. We'll do it like a series.
Yeah, I think
Yeah.
that's great. Meanwhile, they don't know, but you'll be off the show for a long time. So who should do the series? But we'll deal with that at the end of the show. I saw, Priscilla, your hands go up. Was that a mistake? If so, that's
No, it wasn't a mistake. I wanted to type, but it's gonna be too long, so I might as well just say it. Good evening, by the way.
Yeah.
And thank you so much for the talk. I joined a bit late, but I've been enjoying the questions. I wanted to ask a question regarding, there is a bit of racism when it comes to pregnancy and in terms of the care Black women tend to get during pregnancy. There is a lot of talks and organizations that preach like the fact that, there's this general talk that Black women have high pain tolerance and things like that. So how do you then tackle that during pregnancy? Because I feel like with that notion in mind, we tend to get neglected. I don't know if you've ever come across that in your experience as a doctor, and then how do you then advise someone who's pregnant, who's a Black person, wanting to receive the best of care, and so just general advice, really. Thank you.
Yeah, thank you, Priscilla. I think, like you say, you joined in a bit late, and I hit on it. I was saying that what our parents or what our mothers went through is different from what this generation is going through. So I didn't actually do it like Black women per se, but from our culture, the African culture, what happens is that back in those days, they used to do things on their own, more like nothing has really changed where they didn't really have that much support. So they have to like get up and then go to the farm. You see a pregnant woman going to the farm, coming back to come in and cook, going to the market, doing this and doing all of that. And they coined it that they thought that that was the strength, but I say that is not strength. You need the necessary supports, like all the support that you need. Because during that time, we are scared of you doing something to harm yourself and then the baby. Preterm labor, miscarriages, and then all of that. Whether it is true that African women or Black women are very tolerant to pain, it's something that I don't think we should claim for ourselves, because it changes a whole lot of narrative. So you realize that anytime there's any care that is supposed to be given to pregnant women in general, Black women are going to be sidelined, and then we are not going to get that due to the notion that they think that we are tolerant to pain. So I advise that if you start a journey, I said pregnancy is a shared journey between your partner, your husband, your man, your both of you, is a shared journey. So what you need to do, and I even stated that if you start your pregnancy journey, and then your mother, from let's say the father's from the man's side or the woman's side, you shouldn't allow this external influence to get into it, because it might cause a whole lot of problems. That is the reason why you need to schedule a preconception care. Talk everything through with your GP, your gynecologist, or your doctor, and then they are the ones going to guide you through it. So this is what we think you should do. You have to start doing this. You have to start doing that. And if it is ready for, when you are ready for labor, the options that you've chosen, unless there's a complication that we need to change it. So more like a plan, you planning for your future, is the same thing that we do during pregnancy. So you go to the hospital, whatever the health professional is telling you is what you need to adhere to. We know our parents have this thing of, our time, this is how we used to do things, we used to do that. Yes, it is good to take advice, it is good to know, but it is not everything that is actually coming from them that we are supposed to take. And they are also the reason why that narrative is I wouldn't say is still in existence, because imagine your mother coming to a country like or let's say your father or your mother, and then they go like during my time they come to they travel outside, they are they are abroad, and they go like our time we are the one who used to do this, we used to do that, because we are the one telling them, we are forcing this narrative on to them, and they have, I don't know whether it's the white people or whatever, they think that we are strong. As a general rule, every person thinks the black skin is strong, but that is not it. I remember that I went somewhere, I was doing something, and the person that I was working under was like, "Oh, we need a couple of guys to come in and help. The people who are doing it, they are not in based on sizes, they can't do it. So we need you to come." So I went there and I looked at the person and I looked at myself, and I'm like, I'm the same size of this person. And from the look of things, this person might even weigh more than me. So what makes you think that I'll be able to do it? So we have to change that narrative, and we need to stick to what the advice, the medical advice that we are actually getting. Other than that, it's going to continue and continue and continue. So it is good to listen, but it's not everything that you need to take. And sometimes you don't even challenge it. That is one problem. You want to challenge it and improve it. If you've said it's okay, but I have my own plan with my doctor, my GP, my gynecologist, and we have to, that is what I have decided to follow, because they know you better. It becomes their responsibility, because if anything should happen, they'll be held accountable for it. That's what I can say.
Just to add on to that point, because I think Priscilla, I think you're speaking from the point of view of everything that Dr. Kodzo has said is true. I'm just adding based on the experience, my sister being a doctor and what she sees, and she normally says sometimes the advice might come from even the GPs over here, because the GPs have that same notion that we are strong, we overreact. If you're being seen by your doctor. So sometimes I think what my sister normally says is just double down on it. If you know how you're feeling, or if you know that you can't go through this, or if you know you're in pain, double down on it. I think a lot of people in the chats in the past as well, nurses have said double down. Sometimes the GP sends you away because there's this notion that, oh, you are a black woman and you are overreacting, or you are overstating your symptoms, and the kind of treatment they give black women is very different to what they give white women. So you just have to know yourself, and like Dr. Kodzo said before, you and your partner, you work together and you say, this is like, know your family history, know yourself, and just double down and insist and be very vocal about everything that's happening. And yeah, be very vocal and be very proactive in seeking the help that you come from. This is something that my sister has repeatedly said on the show. So that is just in terms of the treatments that we as black women sometimes get here in the UK, which is very different to how they treat other people. So that's just my little bit to add. Sorry, I'm confused because I've got like shows, I've got things coming in. I will take a message sent to me directly, anonymously here, and then I'll come to Auntie Amma and then Princess. So, anonymous question: how long does one need to take Pregnacare Max? Sorry, let me read that again. How long does one need to take Pregnacare Max preconception pills before conception if they're trying to have a baby? You're muted.
All right. The reason why, first of all, if you don't know, pregnant care, it's should I say it's a supplement? It's a prenatal supplement before, during, and after pregnancy. That is what you need to know before, during, and after pregnancy. How long you should take it depends on the stage and why it is needed. So, trying to conceive, you take, first of all, they are trying to push me to talk about medications, which is something I don't want to talk about. All right. General, what you need to know in general. Like I'll state, if for those who join, I don't talk about medications because I don't want anyone to go and take something and it causes some, let's say, complication, and they go like they heard the doctor say it somewhere. So I always prefer that you get screened. And then your doctor assesses you, your GP assesses you, and then So what it normally does is that it helps with nutrients like folic acid. This folic acid that we're talking about, you have something like zinc in there. That is before pregnancy. That is the reason why they probably put you on it. During pregnancy too, it helps with your daily what's it called vitamins. You also have folic acid in there, vitamin D, B12, your calcium, your omega, all of these things, you need them. These are supplements that when you go to the hospital or when you start your A&T, they would give you, depending on what's it called, your assessment. When it comes to postpartum, after birth, I know my boss used to give it. We call there's this one we call pregnant care breastfeeding and pregnant care new mom. There's another one there. While you are breastfeeding, the feedback is back. Okay. It support both them during the breastfeeding period. It support both the mom and then the baby. Sometimes they continue it for, let's say, 6 months or something of that sort. But it's not everyone, depending on what the plan that you have with your specialist or your doctor. So these are all more they are more like supplements that you need for yourself, and after it helps you and then the baby. So I've given you the 3 timelines. So it's not just before. You have it, you can get it before, during it, and after. They have different ones for it.
All right, thank you. Now I'll take Auntie Emma's question.
Good evening, everyone.
Good evening.
Thank you, Dr. Kodzo Asamany. I've not just said something very important which I wanted to say, but because she said it, I'll move on to the next thing that I want to say. I know Priscilla was saying something about that Black women are being left out. Yes, I would say, yes, it's very true. Being a midwife, I see that a lot. But some of the issues are with us, the Black women, and the Black, I won't say just the women, I'll say the partners too, because whilst Dr. Kodzo was talking, he said something about, the men should get involved. How many Black men do get involved in pregnancies? I mean, I know things are changing, but it's not the best. When I used to run, being a midwife, I used to run an antenatal and postnatal group every week. And I can tell you, if let's say I have 20 people coming, out of the 20, let's say the Caucasians are maybe 18, I would say maybe will come with either their partner or their mother or someone in their family. How many the Black women who will be there will just be maybe 2, and they don't come with anyone, which is very serious. It's something that is not just for pregnancy; it's in everything. Because when you talk about even the NHS now is struggling to even treat the Black people, because when they call us for how do you call it, researches, they call us to come in for maybe I won't be research and not be visa to contribute. We don't. They call for people and the Black community will not even turn up. They need to know how to treat us, but we don't turn up. When you talk about, we're talking about pregnancy. Yes, I've been a midwife. Yes, I've seen cesarean section is on the increase when it comes to Black women. Being a midwife, I really sat down to just check, what can we do? Yes, we've got the tilted pelvics, which really sometimes delay us. So if the guidelines says that every woman is being given maybe 1 hour, 2 hours to labor, that's an example. The Black women, the protocol was done based on the Caucasians. We, the black people, have to sit down. Someone should come out, do a research to find out why is it that the black women are having a lot of cesarean section. Why? We need to sit down and analyze it. Nobody wants to do that. Yeah. So again, it makes treating black women or black people very difficult for the healthcare professionals. Very difficult. When you talk about antenatal care, how many black women will attend? They will rather listen to maybe their mother or their sister in the family. Oh, this is the way I did it. But we shouldn't forget that we are individuals. Your mother had normal deliveries. You may not have a normal delivery. And there are things that if we attend antenatal workshop and other things, it will just give us, it will increase our knowledge when it comes to pregnancy, before and after pregnancy. We'll have the information and we'll have the knowledge to move on. So I don't want to, Dr. Kodzo has said a lot. I don't want to just say much, but this is what is going on. We don't avail ourselves to research. That's it. So again, a lot of complaints are coming from the black women. There's a lot of, I'm still affiliated, although I'm retired, I still go in to do voluntary support women on the ward. But this is what is going on. Cesarean section is on the increase. Seriously, among the black women. Is it that we don't want to push? Is it that the protocol or the guidelines which was done is not suitable for us? We need to do research. Why are you doing research? You need to go because I've done quite a few, but it wasn't in labor. I did mine on postnatal infant feeding. So I've got a lot of things which I did. I'm a lactation consultant too. I did more, but when it comes to labor, I did a few, but not much. So please, let's avail ourselves when they call us. Say, steady Pia, now we'll be able to get the answers to our questions. Thank you.
Thank you very much, Auntie Ahmad. Dr. Kodzo, anything to add to that before I move to Princess?
No, thank you very much, Auntie Amber. It's always a pleasure for you to add up to what we know.
Yeah, always. Princess, please, we'll take your question.
Hi, there's more of adding on to everything that has been said. I'm in Ghana, and I must say, some people are also facing what you're facing out there. But my takeaway is find someone, a birthing partner who will be an advocate for you. And I know most doctors don't like this, but before you go to your GP, have your arsenals, be prepared. Be sure what you're describing is what you're going through. Stand on business and just don't take, it's nothing for an answer. Always have your arsenal and make sure your birthing partner is someone who can advocate for you, especially when you're vulnerable. Because when one person is demanding something, it may not go far, but imagine having two people standing on business. That's a big deal. That goes a long way. So make sure your birthing partner, and I like the fact that Dr. Kodzo said it has to be your husband. I mean, you're partners in this. So another thing is no two pregnancies are the same. I have given birth to two, and my experience with the first is not as I experienced with my second. So imagine depending on folklore, this is how it has to be, this is how it is, this is normal, what your doctor is saying is not normal. No two pregnancies are the same. So don't go in thinking this is what my mom said, this is what my mother-in-law said. I mean, there are people who have been asked, GPs telling you a cesarean that's going to save you and your baby's life, and an in-law can actually say, in our family, we don't do CES, and you're going to. So yes, no two pregnancies are the same. Don't go in blind. But imagine your partner being an advocate for you at home and in the hospital. So choosing the right birth partner, ideally your husband going through this, it's amazing. It goes a long way. And do not go to hospitals without being prepared. Have your arsenal, stand on business, and just don't take no. I noticed this whole conversation has been about the pregnancy itself. We are not really touching more on the after. And I'd really like it if Dr. Kojo can say something on the after, the changes women go through mentally, medically, and all that. I'll be very grateful if people pay attention to that, because we sort of depend so much on, having a baby, I'm pregnant, and no one really gets prepared for what comes after. So I think the doctor should really talk about that. Thank
Can I interject here before Dr. Kojo speaks? Princess, it's a great idea. But looking at the time and looking at that topic, there's a lot to unpack, and it's so important, because it doesn't just only pertain to the woman, it also pertains to the partners, because it's a whole process. I personally would recommend Dr. Kojo come back and run a whole session on aftercare, if that's okay, because I think that would be...
Just to chip in, Nana Kwame mentioned, he's asking me if I can join him on TAPTAP tomorrow to talk about postpartum depression. So I think I'll answer that question tomorrow. So
thank you.
Yeah.
There you go. And then you would run another session on here. But fine. Okay, thank you very much.
Can I quickly just say something about what the lady just said? It's very, very important. And I personally believe that before the woman, when the woman gets pregnant, we should actually be telling the women the truth. I always say that we don't really tell the women the truth, or we tell them about the goodness of being pregnant, and so people are just happy. When they have the babies and the reality sets in, that is when we have postnatal depression, when we have all these mental health issues. So it is a very important thing to just say about, talk about the postnatal, the aftercare. And again, I heard Dr. Kojo say something about breastfeeding. Breastfeeding is a very tough issue. When people, I did a little bit of work on that. When people are not being, we are kind of when they have the babies, and breastfeeding is the best, is natural, is this. Then the partner is not able to just breastfeed her. Just imagine. And then when you go for antenatal and they don't tell you, you have a normal delivery, you have a waterbed. And this is what, from the research I did, brought about, a lot of women end up having postnatal depression. It's a topic that Dr. Kojo, I think you need to come back and then really talk about it, because they're very important. And you're just pregnancy and then you leave them there, follow them through to the end. And I think it will reduce the anxiety because let's say you've married, partner, all of a sudden baby kid will be about and taking all your time. You are not prepared for it. And that when people are not prepared for it, we talk about it, now you can't show in the initial stages, now they go in and then face it. I don't want to have any more baby because it's stressful, but I believe, and thank God that I did that when I was in Kent. I tell women the truth. Said, listen, the number of people here, a percentage of you is going to, you're going to have a normal delivery. A percentage of you will have a cesarean section. So you prepare the mind, and then you let the women have an open mind. A very, very important throughout pregnancy. I think I'll stop here because of the time. We'll talk later. Dr. Kojo.
Thank you, Andrea.
Yeah, I absolutely like that. You did, Dr. Kojo says he's going to run what's it called, a whole series on it. And also what Auntie Amma said, and then add the cultural aspect to it, especially because that breastfeeding thing is very, very, I've witnessed it. Can I say first hand or second hand? I don't even know, because I'm not pregnant, but I've witnessed it kind of first, second hand, where I've seen, I know about 3 or 4 people of my age who've given birth, who none of them breastfed. And some of the comments that our mothers make is, because of the way you guys are living your life now, breastfeeding is normal and it should be done everybody. And it depresses you, because it's almost as if to say you're failing as a woman. As a woman, you're supposed to breastfeed, but it's actually absolutely normal not to be able to do that. So I think we should also have that underlying pressure that culture puts on top of women, and then kind of better educate ourselves as well. So I think
Thank you, Abna. What you said is very important because breastfeeding is as much as there's a lot of health benefits in breastfeeding. Being a midwife and an infant feeding coordinator and a lactation consultant, I struggle with my breastfeeding. I did struggle. So I always say, especially when you've had a cesarean section, there are some factors which will have an impact on your feeding. And but our parents or our mothers and our family members think say, oh, so would you have been quiet? There's a certain food which will produce there's a lot of things about this, but I think with time we'll just talk about it. Thank you.
Thank you, Auntie Amma. I'm not sure if Princess, your hand is still up or is from previous submission. Okay. I think it's probably from a previous submission. Oh, this one, our time is fast spent, but I'll try and go through the questions because Dr. Kojo wants to run away from us. But question for Jessica. So this is a follow-up question from the other one that she asked. So the long period of time in which the period was missed was about 2 months. Never had a baby before. Still in my late 20s. Never had medication before. In that specific time, I was not stressed in that period. All the tests were urine tests done at home and the GP. Could this still be due to hormonal imbalances? Or could it be any other anomalies like fibrosis, endometriosis, things like that?
There's a real life situation. Like I said, okay, right. So previous regular periods missed period for about 2 months, right?
Yes.
Remember what she said. And also in late 20s, no
Never had a
significant
baby
strength. What tests?
Urine
What
test.
only urine tests were done?
Yeah,
Okay.
done at home and with the GP.
With
Is
the
this something you want to take offline?
Is she the person? Like I don't know if she's talking about someone else.
It seems like she's speaking about herself. Still
Okay.
in my late.
Mind. I don't mind.
So do you want to take it offline and then have a consultation?
Yes. Is it something that can be done like tomorrow?
Yeah, but if it is you, I wouldn't want to talk about you on the show.
Yeah, that would be fine if you take it offline.
Yeah, good. I wouldn't like to talk about you on the show. Thank you. So, how do you even get? I don't know. Please, you know Nana Kwame? Jess?
No.
Okay. I wanted you to get my.
But
Okay.
these are just not everybody here knows the Aquavi, you know that.
All right. I thought she was probably on the page or something like that. But anyway, can you just message me privately right now that I'll sort that one out before.
Okay.
All right.
Thank you, guys. Thank you, Dr. Kojo. And thank you, Jessica, for sharing the very personal journey that you're going through. Okay, next question. Please, can you shed some light on AMA? I really struggle with that. I would have to Google this, but doctor, I hope you know, on AMA and the necessary preparations prior to conception. Are local medicals, I'm assuming local medicines, a problem during the pregnancy period?
AMA, I don't know if she means advanced maternal age. So if that is it, then for those who don't know AMA, it is a woman who becomes pregnant at the age of 35 or older. First, what was the question again? Sorry.
So, shed light on the necessary preparations on
Okay,
AMA
cool.
and the necessary preparations prior to conception.
All right. It's still the same thing that you need to do, pre-conception checkup, like I mentioned. So you see your GP or your obs and gynae specialist, he will go through your medical history with you. Sorry, excuse me. There'll be physical exams, there'll be blood pressure, glucose checkup, and you discuss any chronic illness that you have. In this case, they will do a fertility assessment. So if the hospital or the GP or wherever you go to, if they do fertility assessment, that is what they will assess you for, because fertility naturally declines with age. So especially after this group of women. So they will do various tests. We have the AMH, we have the day two, day three, day 2, 3 hormonal panel, where we have the FSH, LH, estradiol. These are all hormone testing that we do. Then they might probably do ultrasound. This time around, they'll do transvaginal to assess what we call the ovarian function, and then your uterine health. Yeah. Then they might probably do a genetic counseling. It is not a thing to do, but it could be optional. They will put you on, what's it called, the necessary supplement that you need. And yeah, I think lifestyle adjustment, all these things that I've mentioned before. They also go through your vaccination update and ensure that you have all the necessary vaccine. So it's just all these things that they will take you through, but most especially they do fertility assessments.
Fantastic. Thank you, Doc. And I think the last question, I didn't even get a chance to go through all the questions on my phone, but we'll just have to do that as time goes on through the series. But last question, please, would you advise a 45-year-old lady to get pregnant?
Why not? It is possible. I mean, giving birth is a blessing. Pregnancy at 45 years is possible. I've come across that one once in my life. In as much as it has increased risks and there are challenges compared to younger ages, whether or not you try to get pregnant at this age actually depends on personal factors, including your health, including fertility and life's circumstance. So, yeah. Just like I think it falls under what I just said, the AMA. Yeah, advanced maternal age. So
yeah, Dr. Kojo, I think I'll just add this quickly. When you look at, a lot of people are having babies late now. And I've come across a 55-year-old, a 52, I've seen 45, 47, 40, all ages. Again, as doctor said, yeah, when you wait till late, you have an increase, a lot of things go on. But I've seen 50-year-old having a normal delivery before. So again, it depends on the circumstances. If you can have it early, that's the best. But if you can't, anytime you want to have a baby, I would say you can have, because I've seen a 55-year-old and I've seen a 52-year-old and I've seen all sorts of ages. So yes, thank you.
Thank you, Auntie Emma. Thank you, Dr. Kojo. Very promising. These days, our what's it called? What's the name that we normally give ourselves? Isn't it clock? Biological clock. It seems like it's extended. We have more time to give. But yeah, no, that's great. Thank you so much, Dr. Kojo. Thank you to everyone who's stayed with us for 2 hours and all the questions and all the inputs and constantly all the just making this show a great show. Dr. Kojo, before we go off, do you want to sort of close up any last comments, advice, recommendations that you want to?
Okay. I think thank you all for being here tonight. Whether you came here to support or to just see what it's all about, I'm glad that you spent time with me. It's always an honor to be here and talk about some of these things. And tomorrow I'll be on TAPTAP Send with Nana Kwame, and I'll continue there. So make it a point to join us. Thank you very much.
Yes, please. Let's go support our doctor on TAPTAP, a time of TAPTAP Send. Usually I would encourage you to be on there anyway. So now that Dr. Kojo is on there, there's no reason to miss it. Also, Dr. Kojo is taking a break from the show. Dr. Kojo, do you want to tell us more about that? When we can expect you back on? Because, you have a whole series to run.
Oh.
And Antiama is expecting you. So,
Dr. Kojo, yes, sir. Doctor, don't do that because we've got a lot of unfinished business.
Yes.
So
yes,
I disagree with that.
Yes, me too.
I disagree. Dr. Kojo, you are not taking a break, please. the African community needs you. Thank you. So leave not granted.
Auntie Amma, thank you very much. I think I'll sit back, I'll think about it, and I'll come back again. But what Auntie Amma said is, and the comment that I'm actually reading, it's something that it's a source of encouragement because I didn't want to say this, but I've been slow a little bit before the start of the show because I had something I think some few minutes before we started the show, and these are horrible things that people say about people when they don't really know them. People talk trash. I'm very sorry that I'm doing this here. They say a whole lot of things about people that if you don't open up, this is why I always encourage people to open up and then say your side of the story, because people just pick it up and then they just run along with it. I'm not going to go into details, but today I'm a bit emotional because of some of the things that I had before I came here. And thank you, Auntie Aman, and thank you all for pushing me to come back. So I'm going to go back and then I'll communicate with all of you. I always enjoy doing this, and it is because of you people that I always do it. And it's good to know that I have the support of everyone here. Thank you very much.
Thank you, Dr. Kojo. So Dr. Kojo is not going anywhere. He's with us. We love him and we won't let him go. Thank you, Dr. Kojo, for accepting our listen and staying for us. Thank you.
Yes, I think I could. I just want to say, first of all, I am sorry for whatever you had. We're all human beings and people make mistakes, and people sometimes, a lot of things happen to us. And one moment of whatever is whoever is saying based on why they want to say that doesn't define who you are. I've made loads of mistakes and a snapshot moment of that mistake. And if someone wants to carry me, it's a shame that you had to hear those things, and it's a shame that someone has to talk about you negatively in that way. But over here in this community, you are needed. You are helping, and you are of great value to us, and you're of value to a lot of people as well.
Yes.
Please, please, we need you back because we need to run a whole pregnancy series.
He's not going anywhere.
So we thank you for considering us and that you are staying. So yeah, thank you, Dr. Kojo, very much.
Anyway, it wasn't because of what I heard, that's why I was leaving those, just to make it clear. It was more, what's it called, steady purposes, but I'll find time to chip in.
You cannot turn it. You don't come this week, you come next week. You can always build it in. We'll
work around it.
We'll work around it, but you leave not granted, like Auntie Emma said. We'll work on it. But time is fast spent, and I want to thank everybody. I want to thank you all for the support, the love, and the encouragement for us to continue to keep on the show, and most importantly, the input and the very personal journeys that you guys trust this community with and you share with us on a day-to-day basis. Thank you very much for this. So again, just to remind you, tomorrow, A Time with TAPTAP Send, our very own Dr. Kojo will be back on there talking about pregnancy. And then on Friday, we've got Ask the Lawyer for any immigration. UK's immigration about to change. Things are changing. So, just to keep abreast with it and come with your questions there as well. Once again, the show is brought to you by TAPTAP Send. Like, download, share. And OT Media, thank you so much for doing this with us. And thank you, everybody. And thank you, Dr. Kojo. We love you. And good night, everybody. Thank you so much.
TAPTAP Send. Oh, and was that Bobby, you're from Calabos, the only boss. With oneness, baby, I will be everywhere a day and everywhere they go. TAPTAP Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP Send. Okay? But also, when I receive my money, the other tell the world the channel, like my view, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send. It's secure, convenient, easy, and fast.
So physical money and put me do around to say. So me send jam within a minute in Sabakandia and then one tap send.
Yeah, ebusiafo amanfo within the nakuma pachrewa 1. They recommended TAPTAP Send amamo. And that's how for aba. O send ko fa baby a. Na ye basa. Omo rating so ye. Omo ye A1. Nti obian load TAPTAP Send. Na on say sika for TAPTAP. Piao.
Yɛbɔ hu de wɔkyerɛ amansan yɛbɔ hu de wɔkyerɛ Ghana for say yɛwɔ akwantu ne yɛde sika kɔfie nie me yɛn fɛmfa baabi a yɛbɛnu yɛn ho TAPTAP Send TAPTAP edemu fua TAPTAP Send in this aspect
TAPTAP and one na TAPTAP
the one